everything you need to know about infertility. First question, what is infertility? That's the biggest question, I think. What is infertility? Infertility per se is an inability to conceive after 1 year of trying or attempting if you are below 35. But if you are above 35, it's 6 months of trying to conceive. Trying to conceive, it means you have stopped contraception. Trying to conceive, it means you're not using any barrier like condom. Trying to conceive, it means um, you're using unprotected sex. In other words, you're trying to be pregnant, both partners, right? Then, if that doesn't happen within a year, if you're below 35 or above 35 within 6 months, you really have to stand up and go and look for fertility specialist so that your matter can be attended as soon as possible. Infertility as well can be inability to carry a baby to term. In other words, this will involve people who had miscarriage, preterm, and so forth, or even people with what we call stillbirth. Because the baby didn't reach term, which is 9 months, and the baby was not delivered, and the baby probably was not alive, that will fall under infertility. Therefore, you also need to be seen to be assisted through pregnancy or trying to get into your next pregnancy. A woman who never got pregnant, we call that primary infertility. And somebody as well can be infertile, having one or two child. That we call secondary infertility. What are the causes of infertility in male or in men? That the most common causes in all men, which is what test which we do, is what we call sperm analysis. We look at the sperm production. In that, we look at is there sperm or not. Therefore, no sperm production means there's a problem. Therefore, you cannot make a child. Therefore, you need assistance. Low sperm count, abnormal sperm shape, and low sperm motility, all combined or one, will need you to attend and see a fertility specialist so that you can see or get help. Risk factors to sperm production: it's old age or age, diabetes, hypertension, smoking, heavy alcohol intake, and so forth. Therefore, the first step, if you are a man and you're failing or you couldn't get a pregnancy in your relationship, and you have one of the above: smoking, alcohol use, diabetes, hypertension, you need to get all of those under control. In other words, lifestyle change and control of any other medical condition. Then you can start forward looking to prepare yourself for conceiving. Medical condition that may affect sperm production, very important as well, I talked about already. Diabetes control, hypertension, check whether as a man do you have varicose, retrograde ejaculation as well, and undescended testicles. Therefore, the urologist as well, you must see the urologist probably to seek help, probably so that that condition can be controlled, and then move on to see a fertility specialist for assistance. Medical condition that may cause sperm production or that may affect production of sperms. By that, we mean a person who's probably diagnosed with some form of cancer, chemotherapy, and need to get chemotherapy for that cancer or radiation. It's very important that this message goes through to everybody, especially in South Africa and many other African countries as well, where we get shocked for a young individual, whether male or female, that being diagnosed at a younger age with cancer, and then everybody focus on cancer, doesn't pause for a minute and said, yes, This is a very bad condition. Yes, this is shocking to everybody. But is this treatment, if it's successful, what will happen to me 10 years down the line, 20 years down the line? Am I going to have children or not? And that you must discuss with your oncologist. Your oncologist have to refer you to see a fertility specialist, whether you're a male or female, to try to preserve your fertility by taking your eggs or even taking your sperm and then banking them. So that when you're done with the chemotherapy, you can go back to the fertility specialist. And then if you're ready to have children, then you can use those sperm or eggs which are being banked for you. It's very important because most of my patients, we're seeing them late after radiotherapy or chemotherapy. Already all the sperms are damaged, they are not there, or the ovaries already are damaged. It's very important that this discussion must come into the picture to everybody who's young, happen to be diagnosed with cancer and need chemotherapy or radiotherapy. That is very important. Other medical condition or medication as well, which can cause reduction is small in sperm production. It's like sulfasalazine, uh, which is a medication which you use usually for rheumatoid or ulcerative colitis, which are chronic conditions. Therefore, if you're put on that medication, you probably need to also remind yourself this can affect my sperm production. Calcium channel blockers medication for hypertension as well also affect sperm production. Antidepressants as well do affect sperm production. Anabolic steroids, which you use to get, uh, increase protein production and then, muscles and so forth, that affect sperm production in a big way. Marijuana and cocaine, which are common drugs which you see around, therefore, that impaired and affect direct your sperm production as a male. Then let's talk about women. What causes female infertility? In short, the commonest cause is anovulation. By that, we may look at polycystic ovary syndrome, pelvic infection, endometriosis, uterine fibroid, premature ovarian failure. By that I mean when the ovary cease to function to produce eggs before 35 years. Then we call that premature ovarian failure, which is POF. Previous surgery as well is very important. If you had surgery and you cannot get pregnant, that surgery, remember, can cause adhesions and scarring, which may affect your future reproductivity. What are the risk factors which we should take into consideration as female? Age is very important. Age, I put it first for a number of reasons because we're seeing more and more female or women trying to get pregnant after 35. But if you know that you are going to delay your conception until after 35, it's very important that you consult with your fertility specialist so that you can plan your future ahead. In this case, egg freezing play a major role so that you're not stopping probably to achieve your career, being education, your PhD and so forth. Then you can concentrate on those knowing that your future as well is well planned and your eggs are being banked somewhere in the fertility clinic. Smoking, you can stop that easily. Alcohol, obesity, and STI. Those are the commonest risk factor which we should look for, which can affect our future fertility. Fertility testing in men, the most important, if men come to our clinic, we do what is called semen analysis. We look at the volume of the sperm. We look at the concentration of the sperm, which must be about 15 million, or some people will say 20 million. Morphology of the sperm, at least, more than just 4%, according to Kruger's criteria, which is now put into World HOD, WHOD criteria, even motility as well. We expect at least 32% of your sperm should be moving forward. Also, we add in women during investigation something like hormonal testing and gynecological ultrasound, and if indicated, genetic testing. Infertility testing for women, as I said, hormonal profile, infection screening, gynecological ultrasound, hysterosalpingogram to check the patency of the tubes, hysteroscopy or laparoscopy may be also indicated. Infertility treatment in men, IUI can be used to assist men, especially those with a sperm between 10 and 15 million or just below 20 million. Can be very helpful for those men. But anything below 10 million, then the chances of IUI succeeding is very, very, very small. ICSI has been actually developed to assist men to get pregnant who have low sperm count or who have no sperm count at all. In this case, we attempt to get the sperm direct from the testicles by form of aspiration or biopsy. Infertility treatment in women, In women, it may be ovarian stimulation, what we call OI, IVF, IMSI, tubal reversal, tuboplasty, and so forth. Now let's come to just one fact about fertility statistics. We know that 12% of all women between 15 and 44 will, in one or another, have infertility problem, the whole world. That's a finding of CDC, although it was done in America, mostly in American women. But I think it's one you can refer to all other countries.